Hello, everyone. Welcome to our second week duty here at JR Borja General Hospital. So this is going to be our second week at the medical ward. And welcome to BSN 3B group number 1. This is going to be a brand new week. And of course, I believe that this is going to be an adjustment of this week, especially with our new case scenario that we'll be talking about for this week also. So I hope that this is going to be a learning experience that we'll be having together because as what I've said before, this is going to be a journey of to all of us, especially in this medical ward rotation. Okay, so but before we proceed to our medical or our case scenario, please allow me to share this premise always. I'm here for you. It's literally my life's work to help you grow. Of course, this premise or this specific uh, form of proverb is actually going to be a mindset. It's my mindset, especially with regards to helping students grow and, of course, become a professional nurse in the future. So I believe that all of us can actually have our helping hands together, and that is going to be very important because, of course, without lending your hands to others, you will not be able to succeed that much in the future. Okay, but before we'll have our case scenario, please allow me to read our learning outcomes, which will be the basis of our evaluation later on if you have successfully get the learning outcomes at the end of this case scenario. First, or on completion of this case study, so the nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So these 5 learning outcomes will be the basis of our evaluation later on if you have actually learned a lot from the case scenario that we're going to have this week. Let's proceed now to a reminder for the instructions. Please allow me to read that. First is all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Fourth, base all your answers on the data that is presented and do not assume information that is not provided in the case. So as much as possible, do not actually fabricate your own story because of course that case scenario is going to be based on what is presented in the case history. Next, please follow the format of your output, especially on its font style, font size, paper margin, paper size. And of course, save it as a PDF file and submit all your requirements per group on the date specified as its deadlines. And send all your requirements via the official email address of your clinical instructor. And it is advised that you will submit all your requirements on or before the set deadline of submission. So just a reminder also, I have given you the format on how to save your file in a PDF. So the file name that you're going to have especially in your file, because of course that will actually evaluate or that will actually help me also in the monitoring of your requirements that is being submitted to me also. And also it is very important for you to know my email address, because if you have some questions you might actually as well send me an email, and or for more information also you might as well give me a feedback also via my mobile number that I'll be sharing with you later on. Okay, so now let us focus on the case that we're going to have for this week, and we will be talking about case scenario of patient GH with or diagnosed with hypothyroidism. Okay, I know you're excited. Here we go. Let's begin the history. You are the student nurse in the medical ward of JR Borja General Hospital, where you perform an assessment on patient GH, a 38-year-old woman, Roman Catholic in faith, and is residing at Cugon, Cagayan de Oro City. She is attending a graduate school and is very sedentary. Her chief complaint is overwhelming fatigue that is not relieved by rests. She is so exhausted that she has difficulty walking to classes and trouble concentrating when studying. She reports a recent weight gain of 15 pounds over 2 months without clear changes in her dietary habits. Her face looks puffy. She has experienced excessive hair loss, and her skin is dry and pale. She complains of generalized body aches and pains with frequent muscle cramps and constipation. You noticed she dressed inappropriately warm for the weather. The vital signs are the following: blood pressure of 142 over 84 millimeters mercury, heart rate of 52 beats per minute, respiratory rate of 12 breaths per minute, temperature of 96.8 degree Fahrenheit, or that's 36 degrees Celsius. Laboratory test results includes your thyroid stimulating hormone, that's 20.9 microunits per liter, the thyroid releasing hormone, that's 18.8 nanogram per deciliter. The T3 is 24 microunits per liter, and free T4 it's zero point 0.2 nanogram per deciliter. GH comes in 2 months later for a follow-up visit. You can't believe she is the same person. She looks and walks as if she were 10 years younger. Her skin appears more radiant, and her hair looks much healthier. You can't believe how different I'm feeling, she says. I didn't know how bad off I was. I'm starting to live again. And that is the end of case scenario for a patient with hypothyroidism. Let's proceed now to the high five critical thinking questions. Let's have number one. Compare her vital signs with those of a healthy person of the same age. So patient GH is actually having a difference in the vital signs because of the current condition. So again, the question number one is compare her vital signs with those of a healthy person at her same age. Number two, list 8 general questions you might ask GH to assist in determining what is going on with her. Again, lists 8 general questions you might ask GH to assist in determining what is going on with her. The third one, unnecessary diagnostic tests are expensive. What test do you think would be the most appropriate for RM and why? Again, unnecessary diagnostic tests are expensive. What test do you think would be most appropriate for GH and why? Sorry, that is gonna be GH. The fourth one, interpret GH laboratory results. The fourth one, interpret GH laboratory results. And the fifth one is, why would you want to obtain a complete drug history on GH? Again, why would you want to obtain a complete drug history on GH? So these 5 questions must have to be answered accordingly, and as much as possible answer it according to what you know. And of course, as much as possible, it has to be briefed, and at the same time, no flowery words that will be included. Let's now have the daily duty requirements that you need to submit. Day 0, that's gonna be Tuesday. I'll be posting this case scenario already in my in our e-learning class, and at the same time, day 1 on Wednesday, you have to submit your general objectives, specific objectives, daily plan of activities, physical assessment, pathophysiology, drug study, and nursing care plan. For day 2, that's gonna be Thursday. You have to submit your specific objectives, DPA, survey for day 1, sample nurses notes, FDAR of day 1 and day 2. And of course, you have to have your discharge plan and reflective journal reading. And then for week number 2, you have to submit or follow the case study written requirements that will be posted after some time. Case study requirements, this will be of course a reminder also that you're going to have your introduction, you have to have your nursing health history, physical assessment, anatomy and physiology, pathophysiology. You have to have your diagnostic tests, drug study. If there's no drug available, then you will not include any drug study at all. And then drug problem lists. You can have your nursing care plan, discharge plan, learning outcome, and of course your references, which is also very important because that will be a proof that you will not actually be caught plagiarizing some informations from an online source or from a book. So deadline of submission for your requirements. So let's have your deadline for day 1. The deadline is February 9, 2021. That's Wednesday. So you have to submit at 11:59 p.m. or on before 11:59 p.m. And of course for day 2, that will be submitted February 10, 2021, and that has to be submitted to Thursday before 11:59 p.m. And for the entire week 2 requirements, you have to submit that one on February 15, 2021, and that's Monday. That has to be 11:59 p.m. Okay? So we are all on our own journey, but in this class, we all need one another and will help one another grow. I will be here for you guys. And for my contact details, you can have my email address, and of course my phone number. And you can also have me in your social media accounts with my account. This has been Joseph Bahian Abang at your service to make your best better. Thank you so much. To God be all the glory. Bye.